What is insulin resistance? And what is behind almost every chronic disease you're worried about? I want to ask you something, and I want you to really think about it. Are you tired in a way that sleep doesn't fix? Do you carry weight around your middle that won't budge no matter what you try? Do you get foggy after meals, crave sugar in the afternoon, and wake up at 2 a.m. for no apparent reason? Has a doctor ever looked at your labs and said everything looks normal, and you walk around thinking, then why don't I feel well? If any of that sounds familiar, I want you to know something. You're not crazy and you're not lazy, and your body is not broken beyond repair. This is very likely one common thread running underneath all of those symptoms, and most doctors never look for it, not because they don't care, but because standard screening simply wasn't designed to catch this early. That thread is insulin resistance. Today I'm going to explain what it is, why it matters more than almost any other health number you could track, and what you can do starting right now to find out if it's affecting you. Hi, my name is Dr. Kim. I'm a Board Certified Naturopathic Doctor, a certified natural health professional with over 40 years of clinical experience, and insulin resistance is the single topic I come back to more than any other because it shows up in almost every patient I've ever worked with. Before we dive in, I created a free 1-minute quiz called the 1-Minute Insulin Resistance Quiz that goes along with everything I'm going to teach you today. It's 10 yes or no questions about symptoms you may already be living with. At the end of the quiz, you'll see what your score means, and the link is in the description. Go take it after this video. Now let's get started. Let me tell you what I kept seeing over and over again in my practice. Patients would come to me after years of trying to figure out what was wrong. They'd been to their primary care doctor, and they had blood work done, and they were told that their numbers were normal. Blood sugar was normal, cholesterol was borderline, and their thyroid was fine. But they still felt terrible. They couldn't lose weight. They were exhausted. They had skin tags and darkened patches on the skin on their neck. Their hormones were off, and they couldn't sleep through the night. When I looked at their labs through a functional medicine lens, and when I ordered the tests that standard panels don't include, I kept finding the same thing. Fasting insulin was high. Sometimes it was very high. And when I calculated their HOMA-IR, a simple measurement of insulin resistance, it was elevated in a way that explained every single symptom they'd been told was unrelated. You know, these aren't rare cases. This was the majority. And the more I looked, the more I understood that insulin resistance isn't just a precursor to diabetes. It is the underpinning of almost every major chronic disease we're facing as a society right now. Heart disease, type 2 diabetes, fatty liver, polycystic ovarian syndrome, Alzheimer's disease, which some researchers now call type 3 diabetes, certain hormone-driven cancers, and chronic inflammation. The root is almost always the same, and almost nobody is talking about it in a way that regular people can understand and act on. That's why I built this channel, and that's why I'm here. So let's start at the beginning. What is insulin resistance exactly? Insulin is a hormone made by your pancreas. Its main job is to act like a key. It unlocks your cells so that glucose, which is your blood sugar, can get inside your cells and be used for energy. When everything is working the way it should, you eat, your blood sugar rises, your pancreas releases just enough insulin, your cells open up, glucose goes in, energy is made, and blood sugar comes back down. It's a very beautiful system. But when your cells have been exposed to too much insulin over time, from a high carbohydrate diet, from chronic stress, or poor sleep, or from a sedentary lifestyle, those cells stop responding. They become what's called insulin resistant, and they become resistant to insulin signal. Think of it like this. Imagine knocking on a door. First time you knock, someone answers. But if you knock on that door 100 times a day, every day, eventually, everyone that is inside stops coming to the door. They've tuned out. And that's what happens to your cells. They stop responding to insulin, so the pancreas does what it's designed to do. It knocks louder. It pumps out more insulin, and more and more and more. Now here's where this gets critically important for understanding your health. High insulin, chronically elevated insulin, does three things that explain almost every symptom I described at the beginning of this video. High insulin locks in fat storage mode. Insulin is the most powerful fat-storing hormone in your body. And when it's chronically high, your body cannot access fat for fuel. It doesn't matter how little you eat, and it doesn't matter how much you exercise. The metabolic door to your fat cells is locked. High insulin drives chronic inflammation, and chronic inflammation is the soil in which virtually every chronic disease grows. Heart disease, cancer, Alzheimer's, and autoimmune conditions. And inflammation is not the cause. Insulin resistance is often what's feeding the inflammation. High insulin disrupts every other hormone in your body. TSH, cortisol, estrogen, progesterone, and testosterone. They all operate in relationship to insulin. When insulin is chronically dysregulated, nothing else works the way it should. That's why insulin resistance looks so different from person to person, because it disrupts the entire hormonal cascade and system. Why does standard medicine miss this? I've often asked myself. And you might be wondering the same thing. If this is so common, why isn't my doctor testing for it? And that's a fair question. And the answer isn't that your doctor doesn't care. It's just that standard screening was built around a different goal. Standard medicine looks for a disease. It's designed to catch problems once they've crossed a threshold. Once blood sugar is high enough to diagnose diabetes, once cholesterol is high enough to prescribe a statin, once symptoms are severe enough to require medication. In functional medicine, we look for dysfunction. It asks in functional medicine, where is the system starting to break down before it becomes a diagnosable disease? That is a completely different question, and it requires completely different blood tests. On the functional medicine side, we check function, not just medicate to the numbers. The test that catches insulin resistance early is called fasting insulin. It is not the same as fasting blood glucose. It's a separate test that measures how much insulin your pancreas is having to produce. If fasting insulin is high, even if blood glucose is completely normal, that tells us the system is already under stress. The pancreas is working overtime to keep blood sugar in range. It's compensating, and that compensation comes at a cost. Blood sugar is often the last number to change, and by the time blood sugar is elevated, insulin resistance has typically been present for years, and sometimes even a decade or more. That's the window we're trying to reach, the years before the diagnosis, because that's when the trajectory can actually be changed. I want to take a moment and show you just how wide the reach of insulin resistance actually is. Because I think most people hear the words and think, okay, that's a diabetes thing. That's not me. But here's what the research shows and what I've seen confirmed in clinical practice for 4 decades. In heart disease, insulin resistance drives the kind of inflammation and lipid changes that damage arterial walls. Many people have heart attacks with normal cholesterol, but elevated insulin and high HOMA-IR. Let that sink in for a minute. The cardiovascular risk from insulin resistance is significant and largely underscreened. Alzheimer's disease is growing, and compelling research is linking insulin resistance in the brain to Alzheimer's disease. Some researchers even refer to it as type 3 diabetes. The brain depends on glucose metabolism. When insulin signaling breaks down in neural tissue, cognitive decline can follow. PCOS and hormonal imbalance. Polycystic ovarian syndrome, which affects roughly 1 in 10 women of reproductive age, is driven largely by insulin resistance. High insulin signals the ovaries to overproduce androgens. Then comes irregular cycles, infertility, acne, hair loss, and these are often downstream of insulin, not a standard hormonal or standalone hormonal problem. Fatty liver disease. Non-alcoholic fatty liver disease is now one of the most common liver conditions in the developed world. Insulin resistance is the primary driver. The liver, overwhelmed by chronic insulin signaling, converts excess glucose to fat and stores it in liver tissue. Weight loss resistance. I covered this in depth in another video on this channel, but the short version is this. If you cannot lose weight even when you're doing everything right, chronically elevated insulin may be why. It's not a calorie problem, it's a hormonal problem. And this is why I say insulin resistance is the underpinning of most chronic diseases. Insulin resistance is not just a risk factor. It's just not a contributor. It's the underpinning. If you address this, then you change the trajectory of almost everything else. Now, I want to pause here for a moment because I realize that this can feel like a lot. And your next natural question probably is, okay, how do I know if this is me? That's exactly what the quiz is for. The 1-minute insulin resistance quiz walks you through the 10 symptoms that are commonly associated with insulin resistance. You answer a simple yes or no, you count your score, then you email the results to me, and I personally respond with what I suggest your results should be, what your results are, and I suggest what you can do. You don't need a diagnosis to take action, and you don't need labs, you just need to answer honestly. I think the link is in the description. So, what do you do actually with all this information? First, take the quiz. That's your starting point. It tells us how many symptoms are present and how urgently we need to look deeper. Second, at your next doctor's appointment, ask specifically for a fasting insulin test, not just fasting glucose. Fasting insulin is the test you need, and write it down because some doctors will order it readily and others may push back, and you have every right to ask. Third, if you can get both fasting insulin and fasting glucose on the same lab draw, I can show you how to calculate your own HOMA-IR, and it's a simple formula, and I have a whole video on this channel walking through exactly what to do with those numbers. Fourth, start watching this channel with the understanding that in every video I will come back to this one foundational situation. Whether I'm talking about weight loss resistance, fatigue after meals, or sleep disruption, or hormonal imbalance, insulin is almost always part of the conversation. This is why I built the quiz. 10 questions and 10 videos are coming, which will explain what each symptom actually means and what's happening in your body and what functional medicine looks for that, for what standard medicine typically misses. Now, I spent 40 years watching people struggle with symptoms they were told were normal, and they were told were separate problems with separate solutions. And again, when we look at the right numbers, when we ask the right questions, insulin resistance was always there as a quiet driving force behind the whole thing. You deserve to know this. You deserve a practitioner who looks at the function and not just the disease, and you deserve to understand your own body well enough to ask the right questions. That's what my channel is for, and that's what I'm here for. Take the quiz and email me your score. I read every single one. And if you want to go deeper, if you want to sit down and actually talk through your numbers and your symptoms and what steps you might take or would make sense for you specifically, I offer a 30-minute coaching call. The link for that is also in the description. Start here, watch the series as they are posted to my channel over the next few weeks, and my suggestion is to know your numbers, because when you finally understand what's been driving your symptoms and you take the right steps to address it, things change. I've watched it happen hundreds of times, and it's so exciting. And it can happen for you too. I'm Dr. Kim, the insulin resistance doctor. Know your numbers and change your future.